part of Neurology Simplified. Today I am going to discuss an introduction to seizures, epilepsy, and convulsion. A seizure is a transient event that is due to an abnormality in the brain activity, or you can say it is a cortical activity. And what is the basic underlying pathology? The underlying pathology is a synchronous discharge of cerebral neurons that leads on to various manifestations. Depending upon the area of synchronous activity, the manifestations can be motor, sensory, autonomic, or psychic. So we'll see what is the classification of these seizures. Seizures, as I have mentioned, if it is originating from a focus, a particular region, we call it as a focal seizure. So here the electrical activity starts in this region. So you call this as a focal seizure. You can see the abnormal discharges occurring. So this is what I have mentioned. Seizures are electrical activity that leads on to various manifestations. If the cortex is activated simultaneously, so this is what is called the generalized seizure. So in generalized seizure, the electrical activity occurs bilaterally and the patient loses consciousness from the very beginning. So this is the basic difference between what is in a focal seizure and a generalized seizure. Hope this point is clear. So now we know that the seizures are electrical activities. So what is a convulsion? Convulsion is the motor phenomenon that is occurring. That is, suppose the problem arises in the motor cortex, it leads on to activation of various muscles. So it produces involuntary contraction of particular regions, that is called a motor. So convulsion is the motor manifestation of the electrical activity. So then comes the question, what is epilepsy? Epilepsy is the tendency to have recurrent seizures, usually unprovoked. So by tendency you mean that at least there should be two or a single seizure with either some EEG showing abnormality, structural changes. Epilepsy is tendency to have recurrent seizure. Now we go into the classification of seizure disorders. As mentioned, focal onset, it is based on the site of origin. This can again be divided into two types: focal with awareness. So depending upon the awareness, whether the patient is fully aware of the thing is called focal seizure, or focal onset seizure with awareness if it is impaired with the impaired awareness. Second, we have mentioned about the generalized seizures. The cortex is activated from different regions bilaterally and symmetrically, almost symmetrically. So they are called generalized onset seizures. They can again, depending upon whether motor manifestations are there or not. If the patient loses consciousness with involuntary contraction, which is called a motor seizure. Sometimes the patient may just sitting, staring, not in touch with the surrounding. That is non-motor, otherwise called the absent seizure. If you don't know the onset of origin or the seizure from the history, we call it as unknown onset seizures. So this is how you classify the various types of seizure. This we have already discussed, the focal seizure and generalized seizure. If the focus is not known, we call it as a origin not known. So focal seizures arise from localized brain regions. Manifestations depends upon from where the seizure originates. The terminologies like simple focal, complex focal, or complex partial has been removed in the newer classification. So we divide the seizures into focal seizure and generalized seizure. And subcategories are based on the clinical features, whether it is motor, sensory, autonomic, etc. So we have mentioned that the focal seizures can have either motor manifestation or non-motor manifestations. Among this, we should remember what is called an aura. Aura is a subjective experience about which the patient is aware. It can occur preceding the seizure. So the patient may feel an epigastric discomfort coming before the onset. So that is an example of a aura. This should be distinguished from automatism. Automatism is something that is occurring during seizure about the patient is not aware of. So classical example is the lip smacking. The patient may move the lips, so or fidgeting on the fingers like this. The patient is not aware. So aura is an internal experience. So few words in addition should remember. One is what is called a Jacksonian march. Jackson, because we know that the brain there is a cortical representation, face and hands having maximum representation. Suppose an abnormal electrical activity starts in the region of the face, it may spread on to different regions depending upon the cortical representation. So this explains two features. One, most of the focal seizures either starts in the thumb region or it starts in the angle of the mouth. It spreads on, that is the Jacksonian seizure. Sometimes the eyes may be turned to one side and the head is turning like this. This is called an adversive phenomenon. So these are the few words you should remember regarding the Jacksonian seizure. Second is the thoughts paralysis. Following the focal seizure, patient can develop weakness of that side. It may last for few hours. This is called the thoughts palsy. And this thoughts palsy is important because this can be confused as a hemiparesis or facial-brachial paralysis. Because the history of seizure may be missed. Patient will be brought with weakness. Another terminology is epilepsy partialis continua. It is prolonged partial seizure. So recurrent episodes continuing like this, that is called epilepsy partialis continua. So we have learned about what is in the Jacksonian seizure, what is thoughts paralysis, what is epilepsy partialis continua, and what is the underlying mechanism for this. We just recap the classification 2017. So focal seizure, generalized seizure, unknown onset. Please note it down as 3 basic classification. Then focal onset, aware, impaired awareness. Generalized seizure you divide into motor, non-motor. Motor you differentiate depending upon tonic type, tonic-clonic, etc. The unknown onset again you divide into motor and non-motor, same classification. And there can be unclassified types of seizures. Sometimes the focal seizure can spread and become generalized. So it is focal becoming secondarily generalized. So I will explain once more. A focal seizure can start in the hands like this. It spreads to the upper limb and face and then goes to the other side. It is called the focal becoming secondarily generalized. So the major points we have discussed. What is a seizure? It is an electrical activity, synchronous discharge of cerebral neurons. Epilepsy is the tendency to have recurrent seizure. We have said about the classification and some of the clinical features. So we'll go to a few MCQs to reinforce the definition of epilepsy, seizures, and convulsion. Second question, what are auras in the context of epilepsy and seizures? They are observable symptoms. It is wrong. Sudden loss of consciousness. It is wrong. Subjective internal experiences preceding seizure is the correct answer. Uncontrolled emotion outbursts, it is again wrong answer. So auras are actually focal epilepsies or focal seizures. What is the percentage of population estimated to have at least one seizure at some point of their life? It is approximately 5 to 10%. So if you live sufficiently, the chance of getting a seizure is 5 to 10%. What is the definition of epilepsy? Again, we have defined it. Two or more unprovoked seizures. Any single seizure wrong, correctable it is wrong, a specific type of seizure is wrong. So the epilepsy is a tendency to have recurrent seizure.